Hey everyone, okay, let's look at some muscle anatomy here. I'm going to re-record this audio, so hopefully it sounds okay, and bear with me if it's a little awkward at times. So let's start here with this head and neck model and look at the muscles of the face and neck. The first one that we can look at is the circular muscle around the eye right here, and this is the orbicularis oculi, circular muscle around the eye. This other circular muscle here around the mouth, this is going to be the orbicularis oris. So two circular muscles of the face I'd like us to know. If we move to the side over here, we can see this muscle right here, the masseter. One of the prime muscles of mastication or chewing, there's the masseter right there. Underneath the masseter, you can see this muscle running from front to back. If we remove the masseter, then we can see it over here. This is the buccinator. Here's the buccinator running lengthwise, front to back, through the mouth. While we're over here, we can see this muscle right here, which is in the temporal region, which is the temporalis, which is another muscle of mastication or chewing. Okay, other muscles that we can see here. Why don't we take a look at this one right here? This is the sternocleidomastoid. Pretty easy to remember because it names its origins and insertions. The sternum, the clavicle, and the mastoid process. The sternocleidomastoid. Okay, let's zoom back out a little bit and take a look at the muscles of the torso. And I'm going to use these two for us to look at because there's some deep muscles that we're going to need. This muscle on the left, or the model on the left here. First up, this muscle right here is the diaphragm. It's underneath the lungs, and when it contracts, it pulls air into the lungs. So there's the diaphragm. The diaphragm. We're going to need this deep view in order to see this muscle right here. You can see the front edge right there, but you can see it completely if you look from the inferior view. Let's move over here to the surface muscles. First up, keep in mind that the muscles on the right side of the body over here are the surface muscles, and the muscles on the left side are going to be the deep muscles. So keep that in mind when we're looking at this model here. First up, in the pectoralis region right here, we can see this big muscle here, the pectoralis major. It's the largest muscle in the pectoral region. It does have two heads. You can see the small head and the large head right here. I'm not going to ask us to know the difference between those two, but they kind of start at the sternum and clavicle and insert into the humerus, and they undergo shoulder flexion. Just underneath this pectoralis major muscle, you can see these serrated muscles right here. They look like a little sharp serrated knife, and this is going to be the serratus anterior. Serratus anterior. If we move over here to the deep muscle view, we've removed the pectoralis major, and now we can see the serratus anterior muscle right here, all of them flowing underneath the pectoralis major. Okay, we've got abdominal muscles that we can see right here. Keep in mind, on this anterior surface, we got this huge linea alba and rectus sheath here. It's a bunch of connective tissue covering these muscles. And then the muscles are layered on top of one another. So from the side, we can see the external abdominal obliques, the rectus sheath right here. Here's the rectus abdominis. There they are running up and down. Now if we remove the external abdominal oblique and move over here to the deep muscles, we can see the internal abdominal obliques. How can you tell the difference between the internal and the external abdominal obliques? Well, if you know where the superficial and deep muscles are, that'll help. But if you want to know just by looking at the fibers, the rectus abdomini runs straight up and down, and there is the internal abdominal obliques. You can also tell by the direction of the muscle fibers. So these muscle fibers run down and in, sort of like if you were to put your fingers into the pockets of a coat or something, they would slide right along with those fibers of the external abdominal oblique. Whereas if we move over here to the internal abdominal obliques, notice if you put your fingers in your pocket, they would run against those fibers. So these ones run down and out. Another way that you can tell the difference here. We don't see the transverse abdominals there because they're on the inside. And if we look at this internal view right here, now we can see the transverse abdominis muscles, and they run straight across the body, hence the name transverse, trans meaning across. And these ones, when they flex, they kind of compress the abdominal. All right, let's look at the rear view here. We can see the biggest ones are the easiest ones to look at. First, let's check this muscle right here. We got this trapezoid-shaped muscle, and there's a left one, and there's not, we can see the one on the right, but not the one on the left. That is the trapezius muscle. Underneath there, we can see this large muscle right here, the latissimus dorsi, and it wraps from the vertebra up and into the humerus, and it helps pull our arm down and back. Again, that's the latissimus dorsi. Trapezium right here, trapezoid shaped, and on the back and side we have the latissimus dorsi, sometimes called the latissimus dorsi. Other muscles that we can see this big triangular muscle on the outside of the shoulder. This is the deltoid. The deltoid. A couple different heads that you can see. We can see the sternocleidomastoid up there. And last but not least, we've got this splenius capitis there. We've got to remove the trapezium to see this, but we can see that splenius capitis. That'll help extend the head. Extend the head. Pull the head back. Look up. Okay. Our muscles next. We've got some rotator cuff muscles. So we've removed the deltoid. Let's take a look at these rotator cuff. Here is the teres major. It is not part of the rotator cuff, but there's the teres major. And then we've got several muscles around that make up the rotator cuff. Let's take a look to see if we're looking at the anterior posterior view. How do we tell the difference? The back of the hand versus the front of the hand. So here's going to be the anterior surface. And there's the brachial region up here. We've got our biceps brachii right here. We've got just underneath the biceps brachii, we've got our brachialis. There's the brachialis. Both of them are in the brachial region. The more superficial one is the biceps brachii, and it has two heads right here. So it's the biceps brachii. Then the brachialis, just deep to that. And then on the posterior side, we can see this big muscle right here. We have two heads right there and a third head right there. There's the triceps brachii. The triceps brachii. It's got three major heads, so we call it the triceps brachii. Running around that region here, we can see that muscle right there. This is the brachioradialis. The brachioradialis. More muscles of the forearm. We can see this muscle that slips right underneath the brachioradialis. This is the pronator teres. Pronator teres. If we remove these muscles, we can see that muscle right there. There's the supinator, pronator teres, and the supinator right there for rotating our forearm, or pronation and supination. Other forearm muscles that we can know. Let's put that brachioradialis back for a second here. Okay. Another forearm muscle is this muscle right here. This is the palmaris longus. It squeezes our fingers and flexes our wrist a little bit. How do we know where this is? First, you find this central tendon right here, straight from the palm, and it moves right up to that palmaris longus. So again, to find this palmaris longus, we would find that central tendon and then slide right up, and that's going to be that palmaris longus. Not everyone has a palmaris longus, so if you do, that's where it's going to be. Otherwise, some people just don't have it. A couple other ones that we should know. All of these muscles on the anterior forearm, they all aid in forearm flexion, like I'm doing right there, wrist flexion. And then all of these posterior ones, they go through wrist extension. Forearm, boom. Okay, next up, we've got a couple muscles of the rotator cuff that we should know. Here is the deltoid, so we got to remove that deltoid in order to see the rotator cuff muscles. Here we go. We can see the acromion and the spine of the scapula right here, and then we have muscles on either side of the spine right here. There's 4 rotator cuff muscles I'd like us to know. You can remember them as sits, S-I-T-S. These muscles, there's the supraspinatus muscle above the spine, and there's the infraspinatus. All of those fibers right there, the infraspinatus, because they're below the spine of the scapula. Here, you can see the teres minor, And if we flip the model around and look from an anterior view from the front, we can see this big fan-like muscle right here. This is the subscapularis, or below the scapula. Let's go over one more time. We've got the supraspinatus above the spine, infraspinatus below the spine, teres minor, flip it over, subscapularis, S-I-T-S. Okay, leg muscles. Let's check these out. Which ones do we need to know? Let's start up here at the proximal end. We've got our gluteus maximus, the big muscle in the gluteal region, the gluteus maximus. If we were to move this, we would see the gluteus medius underneath this one. Here's the gluteus maximus removed, and so we can see right there is our gluteus medius, the middle size muscle of the gluteal region. Next up, let's do the quad muscles next. Quad muscles, there are 4 of them, hence the name quad. Let's look at these here. We've got this muscle that runs straight up and down the quad. We've got this rectus femoris. Rectus femoris. Rectus meaning straight up and down, in the femoral region, rectus femoris. Here's a teardrop-shaped muscle on one side and another teardrop-shaped muscle on the other side. These 2 muscles are really big muscles of the quads, and so we call them the vastus muscles. There's a vastus muscle on the medial side. Look at, there's the inside of the foot, so there's the vastus medialis. And then on the outside is the vastus lateralis. You can see the outside part of the foot. There's the vastus lateralis. 2 vastus muscles there that we can see. We need to remove this rectus femoris to find the 4th quad muscle. It's the last vastus muscle, and you can see it right here, and this is the vastus intermedius. Underneath the rectus femoris is our vastus intermedius. There's the 4 quad muscles. Keep in mind that this muscle right here is sometimes misattributed to being a quad muscle. It is not technically a quad muscle. Those 4 that we just talked about are the quads. This one right here is called the sartorius, and it is not part of the quads. So the quad muscles are those gigantic ones. That little one right there, it's the sartorius. Rectus femoris, vastus medialis, vastus lateralis. Underneath we'd have the vastus intermedius, and then we've got our sartorius there. Gluteus maximus, underneath the gluteus medius. Let's move on to these hamstrings next. All right. On the lateral side here, we've got a hamstring, and then we have 2 muscles there on the medial side. This muscle right here, 2 major heads. You can see one head right there, one head right there. This is our biceps femoris. Biceps femoris. 2 heads in the femoral region, biceps femoris. There's the two heads. Then on this side, we can see these two muscles stacked up on top of each other. These are actually two separate muscles. These two muscles are our semi-muscles. The semitendinosus on top, and then the semimembranosus underneath that. How do I remember these? If you were to look at this, if we're looking from the top, looking down, we would see the semitendinosus on top and then semimembranosus underneath. Those are the major hamstring muscles. Next up, let's do some inner thigh muscles here. Looking at this inner thigh region, we can see a few major muscles that adduct the leg. Alright, so first we find the most medial muscle right here. Really long medial muscle on the inside. There's the gracilis. The gracilis. And then we have two adductors on either side. And how do we know which one is which? There's an adductor longus and an adductor magnus. There's an adductor brevis. I'm not going to ask us about that one. So we have here the adductor magnus, huge muscle. If we look from the rear view, from the posterior view, you can see it sitting right there. Adductor magnus, the gracilis right in the middle, and then on the front, the adductor longus. It's a little bit longer, and that's the adductor longus. It's really easy to see it from an anterior view. Gracilis, adductor longus, adductor magnus. Okay, next up, let's look at the muscle on the outer part of the leg. Here is the muscle that attaches to this long tendon right here. This is the tensor fascia lata. I've heard it pronounced a bunch of different ways. I think it's probably the best to pronounce it the tensor fascia lata. And it connects to this IT band, or iliotibial tract. Iliotibial tract, or IT band. Moving down to the distal leg, we can see this big muscle. It's on the anterior side, just next to the tibia. So that must be the tibialis anterior. Tibialis anterior. Flipping it over to the posterior part of our distal leg, here's two huge heads of one muscle. This is the gastrocnemius, or the gastrocnemius. It has a C in it. You can pronounce it or not pronounce it, but it does need to be spelled with a C, and then gastrocnemius or gastrocnemius. Two big heads of one muscle there. Underneath that gastrocnemius, we can see this soleus muscle. If we flip it over, here's the soleus muscle just underneath. How do you know where the soleus is and which ones are part of this calf? The soleus also merges with this big tendon right here, which is the calcaneal tendon, or sometimes called the Achilles tendon, and it meets up with that calcaneal bone right there. The gastrocnemius and the soleus both merge with this calcaneal tendon. The other ones don't, so you can see those muscles there. They don't merge with that calcaneal tendon. All right. Any ones that we're missing? I think that's it. Let's show off one or two more here, though. We need our full body model right here. Here is the deep and interior of the pelvic bone right there. That's the iliac crest right there. There, it goes from the vertebra, inserts into the femur. That muscle right there is the psoas major. It does hip flexion. And you can see the psoas major on this side over here. The psoas major. All right. Here's a full body view here. Let's check these out. Couple more muscles to check out. If we zoom in right here on the thoracic cage, there's a deep muscle right there and a more superficial muscle there. And they run in between the ribs. These deep ones are our internal intercostals, and the superficial ones are the external intercostals. All right, good luck studying, everyone.